Senator Grassley.
I've got 6 issues, no questions. At the end of my issues, you can either agree or disagree or not say anything, whatever you want to do. I've been working to hold pharmacy benefit managers accountable to lower prescription drug costs. I expect you to work with us to hold these powerful drug middlemen accountable and support rural pharmacists. Last year, there were at least 3 bills introduced on pharmacy benefit managers with a total of about 65 senators. So this is a big issue in the United States Senate. On rural health care, I expect you to protect and support access to rural health care. To help achieve this, I believe CMS should take the following actions right away: fill the open slots in the Rural Community Hospital Demonstration Program, distribute the new physician residency slots to rural hospitals as the law requires, ensure that Rural Emergency Hospital Program, which is a program I got passed 5 years ago, is working for rural communities. I've had a big interest in kids with exceptional needs. I expect you to take action to improve care and reduce red tape for kids with complex medical needs. This includes working with states so that they can establish health homes for these kids, as my bipartisan ACE Kids law enabled. Transitional health plans is the 4th one. Since 2013, CMS under President Obama, Trump, and Biden have issued what's called non-enforcement memos to allow transitional health plans to be maintained. About 35,000 Iowa farmers and small business owners have maintained these health insurance coverage with these plans for over a decade. This is the health insurance that was purchased after Obamacare became law, but before it was implemented, and I would expect you to keep access to these health programs. On the subject of waste, fraud, and abuse, improper payments in our major health care programs have averaged $122 billion annually over the past 5 years. I'm the author of a major and more recent updates to the federal government's most powerful tool in fighting fraud. That's the False Claims Act. Since its enactment, it's brought $78 billion of taxpayers' money lost to fraud back to the federal treasury. CMS with the Justice Department must aggressively go after waste, fraud, and abuse and empower whistleblowers, which brings this to the attention of most of the people that are following up on the enforcement of the law. My last one is oversight. In other words, the congressional responsibility of oversight to see that the president faithfully executes the laws, allows us to hold bureaucrats accountable to the rule of law, and helps keep faith with taxpayers. I expect CMS to provide timely and complete responses to congressional oversights, and you've answered that question for the chairman of the committee. When you were in my office, I said you should have said maybe instead of yes, because then you don't turn out to be a liar, like we found over the last 20 or 30 years with the people that have answered that question. So I want you to listen to whistleblowers. You don't know what's going on down in the bowels of that big bureaucracy you have, and you need a culture, because you can't keep track of every whistleblower. You need a culture that will make sure that middle management will pay attention to things that are brought to their attention by whistleblowers and get things corrected. Then they don't have to come to me to get correction made. Now, you can either answer any way you want to. You got 58 seconds.
I'll use all 15 seconds. Yes, 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 and maybe. Only because you said to say maybe when you asked me about responding to your notes, because the reality is we may not get to every note, but every single member of the committee has brought up the fact that CMS has not been responsive. So directionally, we want to make sure you hear back from us, and not just the committee. My hope, and I believe this is a firmly held reality by many folks on the outside, they don't think they can speak to CMS. They don't know where we're going. The private sector can't. The American people can't. Our beneficiaries don't know what's going on. We mail pieces of paper to people. It costs us $350 million a year to do that. Has anyone ever read their Medicare mail? It's just not riveting reading. I believe we can do a much better job by telling the American people what we're going to do, to the point that you actually could imagine us having what most industries do, which is like a developer conference, where you go out and tell industry what you need, tell the American people what you can offer, communicate with them in a frequent and consistent fashion using digital tools. And I believe, based on our conversation, that the biggest advice that I might take from you is look down in the depth charts of CMS for the people who are willing to tell you the truth about what's going on. Don't talk to the head person or the second below them or the third below them. Go down 4 or 5 levels where people really are willing to tell you the truth because they're frustrated, and that's where we'll be able to make a massive improvement in the culture of the organization.
Senator Cantwell.